Recording. Hi, Mr. Bear. My name is Kendall. I'm going to be your nurse today. I'm going to be removing your IV. Do you mind telling me your name and birthday? All right. I'm going to check the wristband. I'm going to verify the physician's order to remove it. I'm going to provide privacy. And I'm going to perform hand hygiene. Just did that. I'm going to go ahead and don gloves. Okay, so I'm going to, before discontinuing, I'm going to make sure that all of my clamps are shut off and that the drip has stopped. I'm going to go ahead and prepare a piece of tape for the site, and I have my gauze. So to begin, I'm going to remove the label that we put on. Maybe. I'm going to stick that over there. I'm going to remove the tape from the piggyback. Again, maybe. Hopefully it won't fall apart. And now I'm going to hold the IV in place while I remove the transparent dressing towards the site of the IV. Pulling towards the site of the IV. Now with all the tape removed, I'm going to place a 2x2 gauze gently over, no pressure, and I'm going to pull back fast and gently. I'm going to inspect the catheter tip for any signs of infection, some blood, pus, or mucus. No. And then I'm going to apply pressure for 2 to 3 minutes. If they were on anticoagulants, I would apply pressure for 5 to 10 minutes. Once the 2 to 3 minutes have passed, I'm going to inspect the site for any signs of infection as well. If I see no signs of infection, I'm going to place a clean 2x2 gauze over the site with some tape over it. Okay, once I have the site taped off, I would go ahead and clean up the area and discontinue the bag. I'm going to remove my gloves and perform hand hygiene, and I would document. So I'm going to document that we discontinued the IV and that I was the nurse that did it. I would document the date and time. I would document the patient's response to the care. I would document the client and family teaching. I would document the amount of fluid that had been infused. I would document that what the site looked like and that the IV catheter tip, what it looked like. And I perform hand hygiene and leave the patient's bed in the lowest position and leave. That's it. You can stop recording now.